Hey, welcome to another episode of HR Nightmares. Thanks for listening and tuning in. HR Nightmares is our safe space to talk about all the stories that we wanted to share in that book as HR professionals. I'm Leath, and I love being the co-host of HR Nightmares. We've got a special co-host today.
All right. Hey, everybody. Andy Almeter, President, Leath HR Group. And I want to introduce Sara Auld. Sarah's with us today.
Our special guest.
So CEO of Upper Health, the health system for wellness. Mm-hmm. Go ahead, Sarah.
Tell us. So you've got a lot of things going on, right? I mean, you are like a startup extraordinaire. You connect other startup folks with each other, but you're in the healthcare tech space. Mm-hmm. And this is like a booming kind of like subspace within technology and SaaS. So we are, recording from one of the top 100 startup ecosystems in the world, Wilmington, North Carolina, which
so amazing.
Yeah, it is amazing.
It really is.
But tell us about Upper Health Possible, all the things that you're involved with right now, and how you're doing it all.
Yeah, well, that's a great question. When I figure that one out, I'll let you know that part. But so what we've been telling people with Upper, the most ear-catching thing I think we could say right now is that the current healthcare system, in plain English, sucks. It sucks. It keeps people sick, right? And so Upper is the new modern healthcare system that makes wellness and natural medicine the most convenient and effortless care you can get on earth. And so we do that with technology.
Okay.
Wow.
Healthcare system sucks. I think everybody can agree with that. I mean, it sucks right now. Is like I'm going through, and all the HR people out there can vibe with me on this. But when I'm going through negotiations right now for next year's healthcare plans, no one can live without insurance in the United States.
No. It's illegal, right?
What?
Is it illegal?
You can I'm pretty sure. So
yeah, pretty much.
I don't think you're going to get fined anymore, but
right.
It's pretty much like everybody needs to get, and Medicaid expansion, is on the governor's desk here in North Carolina. So that's really good. But healthcare, the system does suck, and it starts with the insurance. It's really, really expensive, and for employers that can't afford to pay the full premium every month, this is the second most costly expense for an employer. And as an HR person, I'm always super interested to know what are the supplemental efforts we can be providing our employees and my CFOs with, so that we can keep people healthy, so I can at least keep my premium rates down to not get increased by double digits, but single digits next year. So tell us about how changing wellness and access to natural health can supplement our regular healthcare plans, so we can keep those plan premiums kind of at least stagnant.
Definitely. I think that the most direct answer to the lower cost care, right, at a cash rate would be your concierge medicine companies and the concierge medicine model.
Direct primary care.
Direct primary care model, yes. But you also have a lot of marketplaces popping up now, whether it's for modern medicine, meaning traditional Western healthcare, where you've got, your traditional physicians with pharmaceutical drugs, surgeons, all the way to urgent care is available on those marketplaces. Those are out there now, and they're doing doctor's visits for $19 a visit sometimes. They have very, very low cost care. Wow. And then you get into other concierge marketplaces like Upper, right, where it's natural medicine and really a lot of wellness care, where we're trying to change the narrative of you have all these different independent companies, from fitness companies to nutrition companies, mental health, right, this array of diverse care, and taking all these independent businesses and turning them into one communicating ecosystem, right, with the tech.
Are they cash only?
Yes, so the services on Upper right now are cash only and self-pay rates.
Okay.
Yep.
So these are individual direct care, direct wellness folks. But by the way, you can't get an appointment with a nutritionist right now using health insurance. You can't talk to a nutritionist or a dietitian for 6 months.
It at least doesn't help. You're
having insurance,
and you're truncated to a smaller portion of the available
I think what's so frustrating about health insurance, or at least to me, is that it really drives three different costs of care, right? You have the insurance rate for care, which is obviously the most expensive form of health care you can get, because they regulate what they're willing to pay, what these providers can charge, and so forth. And so there's a whole lot of
Oh, it's insane.
There's a whole lot of back scratching
Yeah.
going on there, right? And so the rate is through the roof. And then you have what's actually the market rate, right? Which is what those self-pay rates are. And then come down to maybe $80 a visit, $70 a visit. Much more fair or reasonable than these $150, $200, $300+ visits that you're seeing with insurance costs. And then you have what's negotiable, right? The bottom floor. And that's what you'll see a lot of these health share companies do, these nonprofits and these religious organizations, where they work with these, they work with their own members at the self-pay rate. Hey, go ask your doctor for a self-pay rate. You're a member of our nonprofit over here, but don't pay your bill yet. And then before you pay your bill, we're going to call and negotiate that doctor even more because we're going to promise them a volume clientele.
Is that what they're doing?
Oh, yeah.
Oh,
Yeah.
just learned something. Thank
Yeah,
you.
you're welcome. Yeah, and they're called other things too. There's health shares, and then there's another word for it that's escaping me right now. But there's different types of organizations using that model.
Yeah.
Where you join the nonprofit,
Right.
and they negotiate for you. But so you have these three costs of care, and what people are not really paying attention to, I think the most, and it's making it worse for people in positions like yours, is that health insurance is constantly looking to expand. Right, and expand its coverage and cover this, and all of a sudden they want to get into gym memberships. They want to get into things that are really our personal responsibility. And so that frustrates me because no one pays attention to, though it sounds wonderful, who's paying for it? Well, we are.
Yeah, it's in the premium.
It's a shared cost.
It's in the premium, it's a shared cost, and now it becomes regulated. Because everything insurance does is dictated by them to say what's healthy and what's not, what's good for you and what's not. And there's health insurance companies right now. I know Blue Cross Blue Shield just got into food as medicine, and they're releasing studies on that through their foundation, some other parts of the company right now. And people online are like, yes, this is amazing. This is great. And I agree with it if it's being used for natural medicine as an option, right? Because you're already ill or you've got something to turn around and so forth. But when it comes to truly just lifestyle and just that being somebody's personal responsibility, your rates are going to keep going through the roof as that continues to expand because they're going to keep dabbling in things that we're going to continue to lose control over and have to pay for.
Yeah, it's a mission creep of what it
Absolutely.
started out to be, right?
Yeah. And waves this big, beautiful flag of this is such a good thing, and it sounds like a great thing.
And it does. And like you said,
Yeah.
people are getting behind it and
Oh,
rallying
so-
for it.
so
and it's
much.
creating a momentum that is going to be tough to stop.
I think so too. Yeah.
Okay, so you worked in traditional healthcare, but you also worked for the federal government. So what's your
Ooh, that sounds really important.
but like what's your take, because I know you're a big believer in what Sara and Upper are doing. Like how can we work in harmony with each other? Traditional healthcare and what she's doing at Upper.
Yeah, I mean, I think staying healthy is the number one thing, right? And I think Sara just said it. It's our responsibility to do that, and it's our responsibility for our gym membership. It's our responsibility to supplement with, a VitaFlow or a company that is really taking a holistic look at your health. We're always going to need health insurance. We're always going to need the hospital. We're always going to need
Catastrophic.
yes, for catastrophic issues. And honestly, still, even if it's before it even gets to catastrophic, I mean, there's some interventions that need to be done.
Oh, sure, definitely.
That are part of this continuum. But on the front end, I'm going to say holistic, but the more holistic, the stuff that you can control. That is our responsibility, and we have to do that, and we have to bear that cost as individuals.
I agree.
And if I do that, I don't want to be lumped into paying for a lot of other people that aren't doing
Who
that.
just decided not to.
Yes. So
Yes.
there's a choice piece. So that's where I come in. I mean, it really is. It's taking care of yourself. It should be number one. There's a lot of focus on that right now, and I like that.
Yeah.
The marketing to do that needs to be, I think, much greater, but it also needs to be incentivized. So one of the biggest focus points at Upper and how and why we design it the way we do and what we're getting into in years to come is this needs to be so mindless that we call it, we actually call it now unavoidable. We're building unavoidable access. Not to force it on anybody, but to make it so much the first option that other options continue to matter less. And those options being unnecessary overprescription of drugs, right, or surgery, things that keep people down, right, and don't empower them. We want to empower the patient. You do that by choice, and you do that by control and the power to go out and do these things that have to do with lifestyle prevention, right? And so, the focus point being if we can incentivize people and build new pathways, new doors, new highways, essentially, whether it's through tech, whether it's, you go to this doctor's office and you're getting a prescription, what is the prescription? Well, they've been educated for how many years to prescribe pharmaceutical drugs. Well, now we go into their offices and now we educate them on prescribing acupuncture, massage therapy, and so forth. And so that's what I do every day now. And so just building all these different pathways to make it so unavoidably accessible that people don't even have to think about it anymore.
How did you get passionate about this?
I grew up in rural America.
What do you mean, like with McDonald's and Cookout, or what?
No, when McDonald's came, everybody was pretty upset about that. But so I grew up in a it was actually called the Village of Windsor. And so truly a village. Yeah. I mean, we had a subway. I had a beautiful high school. Like, we have a great town in the town of Windsor that is also known as the Village of Windsor. But I grew up on 21 acres of open hayfield land. And we grew our own vegetables. We grew our own fruit a lot of the time.
Oh, so the opposite of what I'm thinking about. A lot of rural America is just like has no access to healthy food.
Well,
yeah.
I think that's a big misconception. A lot of those people are living off their land because the folks like myself who grew up in the country and understand the country, I mean, I can't tell you how many of my friends hunt every single day and, come to our house and kill and drag their deer out of the woods. And that's dinner for, however many weeks it's going to be dinner for.
So you have access to a very healthy lifestyle.
I wouldn't even call it, if you live in rural America, the odds are you always have access. It's whether or not you have the strength and the education to go out and get the food yourself is really what it comes down to. Now, again, we have grocery stores. We had one grocery store called the Big M. And so
Big M.
The Big M.
Shout out to the Big M.
Yeah. The Big M was a great spot.
Is that Big M's only shout out?
That's the only shout out they've ever received.
Potentially. That is possible. But yeah, I mean, the school in the town next to mine graduated, I believe, somewhere between 20 and 60 kids a year.
Oh my gosh.
Yeah.
Wow.
My
Small.
school graduated like 180. But
Okay.
we pulled
Still small.
Yeah.
Still small, yeah, and we had to pull from probably a 30-mile radius
Wow.
to fill it. Yeah.
So I think education is one of the big things. It's the know-how. It's knowing that this stuff exists, knowing that you need to have this balance. That's what you lack, I think, in those type environments. Even inner city. I mean, I guess it could cross into any type.
I'd go as far to say that it is the lifestyle of a city that declines the health of a community. It does not necessarily increase it. Now, statistically, and looking at data and epidemics and things like that, like, sure, there's, data that probably says otherwise, but in a lot of ways, people who live in rural areas, they're more connected to nature. And nature has such a prominent effect on your health, between your heart rate, between how well you sleep, the type of food you're eating, how natural and raw it is, or just coming from the earth straight, right? Not traveling from, California or Idaho to get here on the East Coast. There's so many things about living in rural America that make people healthier, and they're not looked at the same way, or the data's not measured, I think, the way it should be, because in cities, people get completely disconnected from nature. It's go, go, go. It's 100-mile-an-hour work life. All this tech, no clean air. The water has Gen X. Like, I could go on and on.
Yeah. It's been around for a bit, and I worked in this realm a little bit with the, environment, built-in infrastructure, and how it affects human health. And it's really interesting how when you do research on that, you're like, oh, wow. It ends up just being head slapping. But there's a reason that that hospitals, a normal inpatient room has got to have a window. I mean, there's reasons for that.
Right.
And it's is to prevent, the downstream of confusion with not knowing if it's daytime or nighttime. So there are tenets that go back even in the most built environment for healthcare that points you right back to environment and how important that is.
Yeah, and imagine having a house with no windows, right? How sad would you be? You'd just be so sad.
Yeah.
Natural light is so important, and getting outside, and that's all something that is heavily not just believed in, but just part of life in rural America. That's not as much part of life in cities.
So tell us about Upper. How does it work? Like, okay, if people are listening and they pull up the App Store and they download Upper, what are they going to find?
So you will see the chat service is the most important thing that we've been telling people about and pushing lately. So this chat service that we have is meant to assist the public in immediately finding, buying, and booking anything in the wellness and natural medicine space, like all the types of care I mentioned before. And so we want kind of like Chat GPT. Have you seen that or gotten familiar with it?
We use it every day.
I use it every day too.
Yeah.
It's
awesome.
amazing. It's amazing.
Yeah.
So I made a post the other day on LinkedIn. Googling is out, conversation is in. And it is. People want to speak in the way or search in the way that they were designed, not how the computer's designed.
Mm-hmm.
You're designed to talk. I'm designed to talk. And we wait for a response and we have interaction. And so this chat service is really to not be so techy, not be so AI oriented. We have some competitors who make all of their marketplaces, just click this and answer this question, not through a chat, but just on their site to filter the care. And sure, those things are important to a degree in helping you find care, but I don't think anything's more important than providing a tech that really enables what the person using it is like and wants. So chat service first and foremost.
Cool.
To streamline communication with the public. And then
So I could say, I'm having a lot of joint pain. Who should I go see? And it'll spit something out to me.
So we don't use AI.
Okay.
It's us on the
It's
chat.
a person.
It's a real person
Wow.
on the chat.
What a concept.
Yeah.
Oh, it's like a chat.
Yeah. It's
Yeah, yeah.
it's a real chat. Right. We're not AI oriented when it comes to the communication aspect of Upper.
Okay.
And so then as we're
So you're
talking,
chatting with a human. On
Chatting
the
with a
chat
human.
feature.
yep,
Okay.
we will ask you a series of questions.
Okay. So I'm having joint pain. And what are you going to tell me?
Where do you live?
I live in Denver, Colorado.
Okay. Are you looking for in-person care, virtual care?
In person.
Okay. Do you want to go to the office or do you want somebody to come to your house?
That sounds good. Somebody come to my house.
Okay. Do you have insurance?
Yes, but I don't want to use it.
Okay. So self-pay. Do you have an HSA or an FSA?
Yes, an HSA.
Okay. So these are the kinds of things we'd ask, right? We
Okay,
narrowed
good.
we narrowed down preferences.
Cool.
And then it gets to the point of here are your options, because while we're talking to you, we are also doing our own research from all of our contacts and network and the internet as well,
Cool.
of what all fits within your preferences. But you essentially have this complimentary virtual assistant doing all this work for you within about 60 seconds.
Nice. How much does
Outstanding.
it cost me?
The chat?
Yeah.
Nothing.
Nothing. Anybody out there can go download. Is it just Upper? Just search
Upper.health.
Upper.health. Download the app. Chat with a real person. Tell them what your pains are, where you live.
Yep.
And then you're gonna be my virtual assistant and tell me how to go pursue natural
As natural as we can find.
as you can
Yep.
find methods of trying to solve my problem.
Yep. And so we would always defer as much as possible to our own providers in the marketplace for the sake that they are vetted. We've seen all their licenses. We've seen all their business insurance policies. We've gone through all their information, right? And then should you go through a marketplace provider in Upper's Marketplace, we can accept payment directly through that chat or have you
Cool.
just check out right there on our platform. You never have to leave the platform. Now, even beyond that, we can book your appointment for you. So there's not a single...
Just in conversation.
There's not a single other person you have to speak to other than that chat to get 100% of the things that you need done.
Neat.
Yeah.
So what if I'm a provider and I want to be on your marketplace? What's the benefit of being on your marketplace versus placing Google ads?
Solid preference. Yeah.
Yeah. Well, so you're really aligning yourself with two major things in our brand. One is being holistic, which I think people confuse a lot with being natural, and that's not what holistic means. Holistic means...
It's the point of view.
Right.
Yeah.
It means looking at all systems that are connected, right, and treating as such. And so if I'm a trainer and you're interested in fitness, I'm still going to remind you about your nutrition.
Right.
And acknowledge that, right? Because food and fitness, they speak to each other in our bodies, right? They impact each other. So that's really the definition of holistic. You're also aligning yourself with natural. And natural is truly, to be very literal, a non-pharmaceutical, non-surgical, essentially, method of treatment, right? So anything earth-derived or human behavior-derived in its care. So you're aligning yourself with that brand.
Okay.
Additionally, you're joining a network of providers who are all referring to each other.
Okay.
Okay.
How does that work?
So right now they can refer within the chat. But Upper's long term is to actually build referral software where they can order appointments with each other for each other on one scheduling system.
I saw those prescription cards.
Did you like those?
Those are cool.
I have them with me. Yes.
Yeah. Instead of a traditional, RX script.
Well, and they can use that. I feel like they still have to use that. They probably do.
Sure.
Sure, yeah.
So what is it?
Do you want me to get them?
Yeah, get one. Yeah, let's get a prop.
No, they're
A
really
visual
cool.
aid.
Okay.
Yeah,
I
yeah,
almost
yeah.
left some on the desk. No, don't do that.
You know the traditional prescription pad?
Yeah. Where a
Um,
doctor prescribes
Yeah.
the
A drug.
penicillin.
A drug.
Okay.
Well, now they can hand these out.
Okay.
Yep. So this is
cool. This is cool.
thanks. So I go to medical centers, doctors' offices, in network, out of network, provider locations all day, and we give them stacks of these cards. People are excited about these. I had a surgeon run out of a C-section. Like he did a C-section, but after the C-section, he comes running down the hospital lobby stairs, and I give him the stack, and he's like, "Give me 10." And he's like, "I got to think about which offices I'm going to put these in, which providers I'm going to give these to." I was like, "Okay." And so
Outstanding.
each time they write a prescription or a referral, it's illegal to brand a script pad.
Right.
And that's not what we're trying to do anyway. These are really business cards, right? But they can give these to the patient or client as they write that referral or script.
Right.
So that the client knows obviously where to go. But we don't have our universal scheduling system yet. And so that is a way to just send them to one chat, or they can write in it themselves, the provider.
Yeah, I think that's great. So the joint pain person,
Yeah.
let's say the OB comes running down the stairs, and had just talked to somebody, that not only just had a baby, but maybe he's got some joint pain.
Yeah.
But yeah,
Definitely after having a baby. Yeah.
This would be a great, thing. Hey, can you check this out? If you're not interested in doing the traditional, I think that this is a very good option.
And pelvic physical
See what's there.
therapy. Pelvic physical therapy is a natural thing to do. It's PT, right? And so that right there, we have multiple pelvic PTs in our network. And so an OBGYN can refer to that right there, and we can help them book their appointment. Yeah.
Awesome. Okay, so upper.health or ontheupper.com, right?
Yeah, upper.health forwards to on the upper right now.
Okay.
We got to get rid of that one.
Okay.
But comes with
okay.
software development.
Upper, so which one do you want people to go to?
Upper.health is easier to remember.
Upper.health, UPPER.health. Okay. And then, I just scanned the QR code here, and it took me, and Sunny wants to know what's going on with me. So,
That's my alias.
Nice.
One time.
if anyone chats her right now, she'll get interrupted here on
They
the
might.
podcast. So.
They might. Is this live?
No, it's not.
Oh, okay.
No.
That's hilarious. Actually, so Andy messaged the chat one time, and I answered right away, and he goes, "Wow, I get the CEO the moment I get on the chat. This is great." And I was
He
like,
did.
"Oh God,
He
okay."
wanted to see if anybody's paying attention.
Yeah.
All right. Oh my God. Well, what do you want to tell people who sit in seats like me, an HR professional, a generalist, a benefits person, a head of HR? Like, what would you want us to know about what you're providing through Upper?
I think what we've learned, so we've done one corporate wellness pilot, and then we've done another group wellness pilot, which we were originally looking at like a corporate account, but it's really a personal gift to a team of people. And so we're not looking at it like a true corporate account anymore. But really we have two group accounts going on. And I think what we're learning in it, this is my most recent observation within the last week of going through the last onboarding. Anybody can shop there. And if any of the HR heads are operating on any kind of like reimbursement model for their staff, or they're looking for really simple, I don't want to say free in the sense of free from cash, but like very freedom-oriented way of providing wellness to their staff, where if you want to use this, great. And if a lot of staff aren't using it or don't want to use it yet, or they haven't bought in yet, why are you paying so much extra money for that head, right, for that account? I think what we've realized is anybody can shop at Upper, right? And anybody can use that chat. And so employers have an opportunity on many marketplaces to let their staff freely shop and have them self-report their expenses to the HR head. Because if the HR head wants to reimburse that, or if the company wants to reimburse that, it can be done. But now you're eliminating potentially, whether that's initiation fees or monthly reporting fees. There's a lot of things that you might not need to necessarily do when it comes to something like wellness if the entire staff has not bought in or using it yet.
So if you're an HR person and you've got a wellness initiative going on in your organization and you say, hey, everybody, here's this thing, it's called Upper, it's a marketplace, you can go out, you can find holistic solutions for your health and wellness, and you can use your HSA or FS flexible spending account to pay for these services. That's also good too, right? Like there's no obligation to me as an HR person. I don't have to pay Upper anything. No, it's just really just kind of advocacy to just be well.
Well, and these marketplaces are up there for the direct consumer, right? And so you can open these corporate benefits programs and whatnot and charge all these extra fees. And sure, you are doing things like Upper is doing things for these corporations as a fees. Like we're handling all the reporting, we're handling all of the monthly expensing. Like we're doing a lot of work for them on the back end, but at the end of the day, it's not necessary, right? And so I also believe, and I say this, I'm probably going to have some HR people or in the benefits broker space like, don't say that. But really though, on your side of the world and saving companies like your company's money on these things, I believe that the future of healthcare is direct to consumer. I do not believe it is through the employer. There's so many people who aren't employed and they end up on government healthcare, right, and all these other things. But the healthcare company that wins direct consumer engagement long term, which is a very long game, but you're talking like Amazon level. Now you're talking access, big access, right? Because everybody has one of these. And I don't care who you are, the government gives you one of these.
Truth.
Everybody has a phone. And so when you have direct consumer engagement and sales, and the employer gives the staff the freedom to use it as they wish, that's good for both companies like marketplaces like mine, and from a cost savings perspective, like companies like yours. Yeah.
Yeah, I think the cost savings piece is big. I think that would be, it gives you negotiating power when it comes time for the negotiations.
I felt like banging my head on the wall recently because you want to do what's common, right? And you, as an entrepreneur, you want to do what sounds and seems like, oh, all the money's in B2B, all the money's in this, all the money's in this. Well, sure, all at once in a big chunk, maybe today, right? But long game, healthcare direct to consumer is ultimate access and the most personalized method of healthcare you could ever create, right? And that's what will allow for that. And so, yeah, I really just have realized that we need to stay direct to consumer as much as possible, and that is how I would do that.
So especially if you are on a self-funded plan where you have over 100, at least in North Carolina, it's how it works. But like if you have over 100 insured employees, you get access to some peek in the box on claims. If you can see that a lot of your claims have to do with joint pain or obesity or, muscle
preventable things.
Preventable things.
Yeah.
I mean, this is a great supplement to what you're doing to control your costs. And then if you move to like a level funded or a self-insured plan, again, like we're always looking and mainly relying on our insurance providers to give us wellness programs. But like they're usually big package, 800 number kind of deals. And so having this as an option, like in a supplement that costs me no extra money, but is possibly going to save me some money on claims.
Yeah.
And by the way, if you're on a level funded plan, you get a surplus access to part of your surplus. So like, yeah, you want to come in below what your carrier thinks you're going to perform at, right? So like if you perform and claim less this year, you'll get access to a surplus, which you share with the insurance company. But like, I want that money because you know what? If I get $10,000 or $100,000 or $200,000 back, like I want to do fun stuff with my employees.
Yeah.
I want to invest in my employees. So this can help me, save money, cost avoidance, cost savings. We don't know. Try it. You won't know till you try.
If you prevent anything, well, then it costs.
Anything. I mean, the thing with this though
if you're
is
happy at your job too.
Yeah, you need you honestly need a champion though. So the best way to, if you're thinking about partnering with companies, is you have to have a person on the inside who's going to constantly remind employees that this is this is a perk. This is something that they should be interested in. You have to have like an educational sort of like webinar on it. You have to email people. You have to Teams people. You have to do a little video of your CEO using it. You have to literally do all the things.
That is so funny. You just said that.
Good.
So one of the things we have learned at the nonprofit, and something I've learned from observing other nonprofits, is that the way to change in communities where there's poverty, right, or there's a lack of access to things or a lack of affordability to things, is not in some mass distribution model.
Yeah.
It is always in, and for a lack of better words, a gang leader.
Yeah.
It's always
it's a trusted coach. It's your preacher. It's
it's having someone who, like you said, a champion, believes in everything, right, that you're doing or about that product or service, et cetera, like social media influencers, right? It's having an influencer who infiltrates their own community with it that people will follow and listen to and are close with. And so you need one of those everywhere, but just one. And that one person can do that for you. Yeah, that's very true.
Yeah. Any questions for Sarah?
I mean, this is amazing. I don't know if any questions, but I mean, I was on there this morning actually.
Yeah.
Of course, I knew the podcast was coming up, but like I was like, I haven't been on the site in a bit. But yeah, you go to the site and automatically, the chat pops up. You can close out of that and peruse, on your own.
Yep.
No, it's like a very. I mean, we just need to get some. We need to get it out there, right? Because this is, aside from all the cost savings, cost avoidance, it's, I'll say it again, it's our responsibility to do this. We have to take care of ourselves, and there are a lot of resources out there to help you. But if you don't know how to access them, or if you don't know they exist, Upper can do that for you. You just have to tell Upper what your issues are and what your concerns are.
And we're creating champions too. To Lisa's point, and like what you said, get it out there and educate people. So our champions are providers, right? Because I can't tell you how often I hear, oh, well, my doctor said this or my doctor said this, and it's always about what the doctor said.
Yep.
Right? Which is fine. It just goes to show who people trust, want their information from, listen to, and behave accordingly to, right? And so we all have that. Whether that's your doctor, a parent, a friend, it doesn't matter who, we all have a trusted source. And when it comes to health and wellness, it's going to be for us more than likely a coach or a doctor, right? And so going through the provider to be the champion and do the education is becoming
absolutely
huge. Yeah,
that's
key.
really cool.
Yeah,
very good. If I live, where do I have to live to use Upper?
We are very dense in Wilmington, primarily.
We
have
have North Carolina.
Yeah, we have some providers in Raleigh. We've got a couple random ones, Florida, and then we have a client in Tennessee. Like, we have some interesting random spots here and there, but for the most part, we're dense in Wilmington. We are filed in 28 states, so we can do business in 28 states, but we will scale outward from our nucleus.
Good. So North Carolina, southeastern North Carolina for now, but spidering out, want to do business other places. What is your biggest ask from anybody listening, whether they're an employee somewhere or an HR person or a benefits person or just somebody tuning in? And I think we've listened to in 41 states at this point. Like, what would you ask? Maybe it's a doctor listening. Who knows? Like, what would you ask of people to do? Stop
letting your employees, your friends, or your patients Google search for their care, because they stay lost, they stay confused, and they'll likely never even get to it.
Yeah.
Give them a free front door, which is the chat service.
Upper.health.
They can use it anytime. It is the gateway into an entire ecosystem they'll never have to exit.
Even Boulder, Colorado.
Yeah.
I mean, seriously,
it doesn't matter where you are. Yeah, anybody can use the chat.
You're gonna get, you're gonna get somebody,
a virtual assistant.
And you're gonna get pointed in the right direction.
We had somebody use the chat the same week it went up from Denver, Colorado, to apply for a job as a nurse.
Oh, cool. So
that's awesome.
funny.
She had a resume in the chat. I was like, I didn't even know this thing accepted resumes. I knew we could take payment, but I'm getting resumes in the chat. Okay.
Oh, that's funny.
It was good.
You have to thank your developer.
Oh, yeah. Definitely. Definitely.
Well, so we always take it back to like HR nightmares, and we really try to help people avoid HR nightmares.
Yeah.
So an HR nightmare for every HR person out there is rising healthcare costs for their business. We just spend, I mean, like I said, it's the number 2 cost behind salaries at any organization. And so we gotta keep our costs at least stagnant or try to lower them to the best of our ability, get our employees to be more healthy, focus on their wellness, put it at the forefront of your HR initiatives. And
It's going to increase productivity.
Yeah, I mean, healthy employees are happy employees, and they're going to be more productive.
They're going to miss less work, and they're
Yeah.
going to be more productive. And
Yeah.
Upper Health can
That's true.
can help with that.
That's true.
It's so simple.
Yeah, it really is so simple.
Get your employees to be a little bit more healthy. All right, we're gonna start using. You used Upper this morning. That's cool.
Absolutely.
I'm gonna start introducing this to folks that I come in contact with. I want to thank you for sharing.
Thanks, Lisa. Thanks, Andy.
Yes, thank you. Thanks
Appreciate
for
you guys
coming.
having me on.
Any other parting words for us?
I just really appreciate being on.
What's your
Leath HR.
personal motto?
Personal motto? Oh, geez, that changes like once a week.
Curveball.
I hope I evolve constantly, so that always evolves with me. Personal motto. I don't know if I have one.
That might be it.
That's hard to.
Evolve.
I evolve weekly.
Evolve weekly.
Yeah, no, I like it.
I will take that.
You've got like a lot of moxie. You're a go-getter. For anybody that started their own business, cheers to us. It's hard. It's hard out
so
there for
hard.
a hustler.
Yeah. Yes.
So you got to support each other for real. And like everybody listening to this, please go follow Upper on all the socials. Wherever you follow folks, make sure you're following Leath HR Group and subscribing. If you like what you hear, share it with your friends. But definitely, you can listen to us on YouTube. You can listen anywhere you listen to your podcast while you're out on your walk, or you're driving to work, or you're taking a road trip for work. And then check out worktalk.com. It's our own employee check-in app. It's super cheap, super affordable, and very easy to use. We want to make sure you're having a good relationship with your employees. So any parting words, co-host?
No, I thank you. Thanks for your time,
Thank
Sarah.
you,
This is
guys.
awesome. I can't wait to dig in more, and we'll definitely do our part to be to spread the word. And I would love to see more and more providers jump on board, because that, like you
Us
said,
too.
is the key.
Yeah, it definitely is.
All right. Avoid rising healthcare costs at your organization, and go check out upper.health.
Stop supporting prevention and health insurance.
Let's do it. Upper.health. Thank you.
Cheers.